This program was first broadcast on Canterbury's access media station, Plains FM, and was made with the assistance of New Zealand On Air.
Hey! Come on!
Babes, listen. It's time to jump on into it with your pals Nat and Jess and catch up on all things women's health and fitness.
Hello, Babes listeners. Welcome to another episode of...
Babes, listen.
Yes, well done. That was quick.
I know.
Well done.
I wasn't real sure what I was going to say, but I'm very excited to not be the only blonde in the room today. That's what I am excited about.
Wow, cliffhanger.
Who's the other blonde? Welcome, Niamh.
Thank you.
How are you?
I'm good, thank you.
So this is a great time to announce that we have the lovely Niamh joining us today, who has a very interesting job.
And background and everything.
Yeah, so
Interesting person.
Yeah, so we'll chat a lot more about that, and I think this is going to be a very interesting podcast. So the job situation is, this is a test for me, a pelvic health physio.
It's not that hard to say.
That is
really
correct.
not that hard to remember.
Is that? Do you know what? I think I'm just exhausted from studying. Honestly, I can't remember anything.
First of all, how's your week been?
Been good. Yes. Busy.
Busy with work?
Fast.
Yeah. That's life just goes by. Do you know what? There were these two instructors that went to Italy for a month, right? And they were back this morning, and I was like, has it been a month? I'm sure you left last week. And they're like, it's been a month. It's got real quick. How's your week been?
Well, honestly, just a blur of, I think, studying. That's pretty much like
What are you studying?
boring psychology. Oh. Yeah, I'm finishing off the degree I started 21 years ago.
Oh, wow.
Yeah.
That's amazing.
Yeah,
Good on you.
yeah.
It is amazing.
Yeah, we'll get there finally.
Wow.
Had
Yeah.
an exam yesterday.
I did, yes. And so what I will say, though, the difference between studying when I was 20 versus 41 is that that ability to just learn stuff by reading it a couple of times and then seeing a prompt of it in the exam and it coming out. There's a disconnect now. I think it's just years of having to remember too many things.
Or sleep deprivation, raising children.
Yeah,
That
could be.
too.
That
You
could
did
be it.
say mum brain was a thing for you and you feel like it's still there.
Baby brain.
Sorry, baby brain.
You know, like baby brain when you get pregnant. I don't remember baby brain ever leaving.
No.
And my youngest is
Is
15.
that same for you?
Yeah. And then you hit that. We talked a little bit earlier about perimenopause, or, you're in your 40s and you're like, oh, is that part of the start of menopause? Or is it just that I'm really busy, mum?
It's hard to
Working
tell.
Yeah.
It's hard to tell.
Yeah.
Yes, it's that kind of stage. So, Niamh, you've got 2 children.
Yep.
And you mentioned that they are 8 and 10, which is such a cute age.
Yeah.
And you agreed with me completely.
Yeah.
On air,
It's a cute
that's what
age.
we're saying.
It is a cute age. Yes.
Yes. And so you are working in Christchurch, but this is not where you grew up.
No, from Dublin originally. So I've been in New Zealand for 20 years now, nearly 20 years. And I studied in the UK for 5 years doing physiotherapy and I did exercise physiology, and I actually was a fitness instructor.
That's so cool. Tell us what you taught.
Step aerobics. Do you remember that? Like
Oh, we still got it.
I'm
It's
like
called
44.
Body Step.
Oh my gosh.
In Les Mills, and now is it Functional Step? Is that what it's called now? It's got a new name. What? I'm asking you, Jess. There's no
Not
one
the group fitness
behind
manager
you.
anymore.
Okay, you don't have to know. It's not a quiz. But yeah, it's still going strong.
Wow. That was a hard class. Spin
Yeah.
was my favourite thing to teach because it was just easy and you didn't have to be very coordinated. So, and then I went on to do physiotherapy and did my postgrad in sports medicine in Otago when I came to move to New Zealand. And now I do women's health, which is
So cool.
very different, but similar. We're a little bit unique in that it's an ever-growing industry in physiotherapy. It's only kind of becoming something that people did in the last 10 years or so.
Okay.
Yeah, so there's people in their 50s and 60s and 70s that I find don't even know that my profession exists, which is so interesting when you have a room full of women of different ages and stages. We're in this unique phase that so many women didn't have those opportunities when they gave birth, in your mums or in those ages of 60s, 70s, they didn't even know what a women's health physio was because it wasn't around when they were having children, and now their children, this is going to be slowly becoming just the norm of what people do after they have babies.
So tell us what how you help your patients. What kind of specialities do you go into?
So for a women's health physio, or we call ourselves pelvic health physios because some physios treat men as well.
Right.
And in my practice, I treat anybody with any issue around their pelvis. So that can be from 18 all the way up to 85, 90 with like stress incontinence, which can be urine, fecal incontinence, painful sex, endometriosis, vulvovaginal conditions such as like vulvodynia or vaginismus, which is quite common.
Is it? Because I've never heard of it, so I'm very curious to know what that even is.
Yeah, what is that?
So it's like a really high tone pelvic floor, and you get spasm in your pelvic floor, and you get pain with things like sex and a vulvovaginal disease is more like lichen sclerosis and lots of different type of conditions you can get around the vulva that cause pain and irritation. Becoming much more common than what we think. Yeah.
Why? Yeah.
Why is that?
Snap. Why is that? We're on the edge of our seats.
I don't. Yeah. Well,
so interesting.
I don't know whether we're just becoming more aware of these things, or there's just so much more issues and conditions and autoimmune. We talk about the microbiome and the incidence of microbiome, which is like your gut bacteria in relation to things like endometriosis and your gut microbiome. And you girls will know so much more about this because of your industry, but your gut microbiome is so influential in what happens to your vaginal pH, which is like your acidity and the pH of your vagina, and what how that affects your symptoms, such as like irritation or redness or the clothes that you wear. So when, we can talk about this, but we always say, like, don't wear your sweaty gym clothes all day.
Yeah.
Like women are wearing like a lot of compressed fibers, or what you're putting on your skin, how you wash your vagina, all of those things are things that we have to like educate people about, because those things have changed quite a lot.
So you're saying if I know what you mean with don't wear your, because obviously we're in this industry where you might have a class and then have clients after.
Yeah.
And then I hate being in sweaty clothes, and sometimes you don't get a choice. But like today, for example, I had time to get changed. Yeah. So I didn't shower, but I got changed quickly. Yeah. So you're saying what changes if you were to sit in your sweaty clothes for too long?
It can just be like there's no specific research at the moment, but the people, when we see people who've developed some conditions, it's either internally or their nervous system is heightened, and then they start getting irritation, redness. Yeah. And for when you have, if you're predisposed to that kind of condition, then definitely sweaty clothes, tight garments, they'll say will actually cause them a lot of pain. And it's really hard to calm down. So we would say don't wear sweaty clothes for long periods of time. Yeah. Make sure that you're not putting chemicals onto your vagina, and we call it, in America, they call it like douching. Have you heard that word? Yeah.
Yeah.
Douching.
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 Like
yes. Sorry. Yeah.
You shouldn't actually be scrubbing your genitals with anything. Just water and your hand is all that people need to actually wash that area.
So when you say chemicals, do you mean like, say, body wash?
Yeah, like body wash, or even things that say that they're vaginal shower gel.
Like the sensitive stuff. Really, don't use that.
Well,
I use that.
I just say
like the stuff that's meant to be.
Yeah. I would just say, look at what's in it.
Yeah. I won't know what it means. Because I'll send it to you.
Like
screenshot.
There's lots of chemicals. Yeah, there's lots of chemicals.
Interesting. So you're saying just water?
Yeah, just water.
Yeah. See, these are the tips that you won't
hear
anywhere else.
How are they going to make money? if it's just water.
I know.
Oh, but we don't know they, so we don't care. We want what's best for the woman. That's what we're here for.
Yeah, this is it.
See, this is stuff that I think is so interesting because you wouldn't get to learn about this stuff unless someone was to come to see you with a problem.
Yeah.
So we're trying to minimise the problems.
Yeah.
Yes, and also, you know, how common is it that someone has been suffering with symptoms for a long time before they come to see you? Because what's normal and what's not normal?
Exactly, yeah.
Yeah. Well, also, it's not the most easiest thing to go to your doctor about and say, oh, I've got, you know, redness, irritation, dryness. Like it's normal if you're menopausal from on, because we talk about women get vaginal dryness and we get lots of issues in our 50s, and there is products that you need to use for that phase of your life. And you talk to your doctor, and what for young people, it's very much not talked about.
Yeah, we don't talk about it. Speaking of products, just while we're there, Niamh actually, so if you've been to our, what are we calling it? Workshop. What is it called again?
Babes Move.
Yeah, sorry, yes, but like it was a workshop.
It was life changing.
It was the best thing ever. Okay.
And
if you came to Babes Move and you got a goodie bag, I mean you would have because everybody got one, Niamh actually provided a new product to us. Do you want to talk a little bit about that?
Yeah, so that is our new balm. It's an oil-based lubricant, which is also can be used as a vaginal moisturizer. There's got no chemicals in it, and originally myself and the gynecologist that I work with, I thought, why can't we just make something from New Zealand? It's got Canuka beeswax and olive oil in it that can help all of these women that we're seeing, from young people with painful sex for reasons like endometriosis or the vaginismus, which is like high tone pelvic floor. In fact, a lot of people who exercise a lot would have what we say is a high tone pelvic floor. So they don't necessarily need to use pelvic floor training, but they might sometimes need to do down training. We can talk a little about that.
Really?
That's really important, yeah. But and so the oil-based lubricant is something that we've brought onto the market this year that we're super proud of, because we want to be able to almost use the product to like share some knowledge about looking after your vulva, the changes that can happen, what it can be used for, and also most lubricants are designed for penises.
It's
I don't know if anybody's noticed that.
designed for
I
penises.
thought that was the only option. Yes.
Yeah.
Sticky and full of chemicals and aren't really designed for a vulva. So we want to have a lubricant that's designed for the vulval tissues, that feels much nicer on the vulva tissue. And then if people want to have intercourse, we call it outer course intercourse, then it's also safe to use for that. It's not to be used with condoms, however.
Okay.
Yeah, no,
Good
at
to
the
know
moment
that.
it's not been tested yet.
Yeah. How did you come up with the recipe? That's my question.
A lot of research, and we used a manufacturing company in Christchurch actually that does a lot of cosmetics, and they helped us get the perfect consistency, and that's probably from our clinical experience. And women's health physios and pelvic health physios will know a lot about lubricants, and there are some other ones on the market that we have been using, and so it's probably trying to take the best of the best and but making it better. Like we're like, we want this bit.
So how long did that take to come up with the best? With the best consistency and recipe and everything.
About a year.
About a year.
Yeah.
Yeah. So that's a good amount of time. Because I remember looking at the ingredients and being like, beeswax, olive oil. What? What is this? But so cool because it's all natural products.
Yeah, and all made in New Zealand, and not processed, because we wanted to make sure it's just the product and to have as little effect on tissue as possible, but also have a little bit of moisturising effect. Yeah,
cool.
So we're pretty excited to be able to bring it to the market and see. Yeah.
Well, we were lucky because you gave us those samples before you had launched it.
Yeah.
So Babes Move gals, you're welcome.
Yes. And feedback, negative, positive, any feedback is really welcome, because there's in the first few years of anything, we're always trying to make sure that we're hitting the mark where we think we are, but also we can make changes if we need to as we go on to the next stage.
We'll pull that out too.
The other thing about lubricants is, now that, you know, this is like my physio's favourite things to talk about.
Is it?
Women's health physios love talking about lubricants.
It's good to know. I'll know what to pull out at dinner party.
Because it's like not talked about, and it's almost like this taboo about. People think there's something wrong with you if you go and buy lubricant, but there's
they
not.
try and hide it, right? Like bottom of the trolley.
Like why couldn't we live in a society that boys already have the oil-based lubricant when they go out with their partner, or you know, why is it always like either made for males, or why would not females not already have their own lubricant? Like, just doesn't have to be anything wrong with us, but why would we not want to use a moisturiser? Because sometimes you might have been on your spin bike for 3 hours, or your vagina might be a little bit sensitive. So why don't we make it more normal that would just be something that you could have? That's not a taboo subject. Yeah, so that was one thing. And the other thing is that a lot of women, as they, if you've had certain type of cancers, or you're menopausal, postmenopausal, you might not be able to use things like estrogen cream or other medicated or the medications that you get in that phase of your life, which is atrophy, which is a dryness and lack of elasticity, lack of lubrication. So having a product like that is just kind of more for those type of people as well.
Right.
Yeah.
So cool. So interesting. I think just the subject sex is taboo, you know, like people don't talk about it. Yeah. So I think it's cool that you've just got this whole product about that.
It's such a
for women.
It's such a good talking point as well. Like you said, just to normalise that conversation as well. On the topic of sex, how, like, for someone who's experiencing painful sex, how long does it usually take that person to realise that that's not normal and then kind of seek help? Like, at what point are people coming to see you about it?
I think I see a lot of people with endometriosis, so I think that often as a teenager they've come through years of having really painful periods and struggling with, perhaps for a female, again, this is another issue that I have, that, you know, often girls don't touch their genitals until they try and put a tampon up there, and that's like the first thing, whereas you've got 2 boys, so boys just grow up like touching their genitals all the time, and it's just quite a normal thing, and it's
really
not,
do.
And whereas I feel like society would tell girls to stop touching yourself if we walked around all day touching or fixing our bits all day. Like, we just don't do that as females. And so I think we need to encourage girls to really know what their bodies are like from a young age, as opposed to, you know, when they get their period and then they're in pain and then you give them a tampon and say, oh, put that up there. So it's already not like a very like a nice situation, or to know about their vulvas, and often they haven't even looked at what their anatomy is for. And often, I don't know about you, but I grew up in Ireland and I didn't even know like what a vagina or a vulva was. Like, nobody even told me what was in there, what the holes are for, how many holes you have. We didn't learn any of that when I was growing up.
Didn't have sex education?
Not in Ireland, no.
Yeah.
Did you have sex education? I think we had like one session or something. Like, I went to a Catholic school though, so it was like they didn't talk about like abortions and it's the truth.
Don't
though.
get pregnant. Yeah.
It was basically like, don't do it otherwise.
Until you're married.
Yeah. But did you have sex education? Why are you awkward?
So.
Why are you awkward?
Because my memory is terrible. And now I'm like, did I even?
I honestly
really
don't
remember.
I don't think it's talked enough about, like you say.
And also, not just about the sexual health side of it. So about their bodies and learning about their own bodies and giving them the confidence to be able to know what's normal for them before they even get their period, or, you know, in those teenage years for girls especially. But so when a girl has, then that will be off. Go back to what you asked me at the start. When they start having pain with putting a tampon in, that can be a trigger that they might have pain when they start having intercourse when they get older. And when you have endometriosis or any kind of a pelvic health condition, or it can really make your pelvic floor very, very vulnerable and become what we call hypertonic or high tone. So you can have a really tight pelvic floor, which is important to then be able to learn how to relax that pelvic floor. So your pelvic floor shouldn't be, by the way, your pelvic floor is just a group of muscles that sits around your pelvic organs and supports your bladder and your bowel and your uterus and helps the entry and exit of your wheeze and poos. Okay, so it's important that you're able to hold on, but it also is really important that it relaxes as well. So any of the research tends to be on CrossFitters. Like, we just don't have enough research on women. There's like a lack of research on women in general compared to males in exercise physiology. So there's a lack of research, but we do know that a lot of women who haven't had babies like leak urine and feces and have issues with high tone pelvic floor. So it's a really important thing to also tell women that you don't have to have just had a baby or to have endometriosis to have issues around the area. Like, everyone should know their body, know how they move, just like they do with their hips and their knees and when you're doing your exercise classes. But also, not everybody has to do pelvic floor exercises. Like, everyone's unique in how their pelvic floor functions.
That's interesting because that's what I'm wondering is this. Pilates has got a lot of attention and pelvic floor and the importance of that. I did know someone in Dublin, though, that had the issue of being too toned and needing to relax. And but I didn't know how common that was.
Yeah, it's very common, yeah.
So everyone's so different.
So different. And what you do with the rest of your body, the other reason I wonder is we're becoming very, anxious, or there's lots of things like anything like to do with anxiety or can make your tone much more heightened. So if you have got another medical condition, or if you do just suffer with other issues or anxiety or any mental health issues, that can really make everything really tight around the area, or certain medications can affect it as well. Or if you're doing too much of one particular exercise. So I don't know how you guys feel about, but doing, say, your HIIT training every day. Like, would you do high intensity every single day?
Oh, yeah.
Or,
no, I'm joking.
Nat, or like, Nat's really passionate about the subject.
Because aren't our bodies designed to do like strength, like your strength training a certain amount of times, and then your cardiovascular training, but also your lengthening and your mobility and your function, like how to balance our bodies. And if you're doing 7 days of the same thing every day, in my experience, a lot of those people have very high tone pelvic floors.
Oh, yeah, I bet they do. I mean, I don't see that side of it, but I see the injury side of it, and the body being in constant stress, because you're just constantly putting it under stress and not resting. Yeah, no, Jess and Nat in our seminars, and we've done like I think an episode on it a long time ago, we've talked extensively about overtraining and overdoing just HIIT, especially because high intensity training was so popular. Well, it became such a cool new way to work out, especially with gyms having their whole methodology around high intensity, like full gyms that just do high intensity classes. Yeah. So people would be like, oh, sweet. So that tells me that it's 30 minutes, I'm in and out fast, and I'm sweating lots, and I'm burning lots of calories, so it must be good. But then they do it, like you say, 5-7 days a week. So yeah, and they overdo it. Yeah, and I can only imagine what their pelvic floor would be like.
Yeah. That's so interesting.
So then do you tell them you need to have more variety and more rest days? And
yeah, I think I just try and say, can you implement certain things that are going to help with your diaphragm, which relates to your pelvic floor. I'm going to use my hands because, I'm a physio.
Go for it. Yeah.
But, your diaphragm's up here and your pelvic floor is down here. So they need to move dynamically together. So they shouldn't be on all the time, and they shouldn't be completely relaxed all the time. They should just move with each of your movements. So when you're doing your HIIT, they need to be working still together, but also then they need to be able to lengthen and relax when you're sitting down. And so I try and just educate them and hope that they
Good.
come to that decision. Like, I would never say to a new mom, "Oh, don't go to your," am I allowed to say F45? Yeah. Or, you know, like, as in, don't go to your F45 if you're on the verge of mentally just being I just need to go and get out of my house and it's somewhere I can take my baby, and I'll say go to your F45, and I'll help them to modify it and just say, just go and do like this and this. But if that's mentally going to really, really help you, I know I'm using an extreme hypothetical example here, but if that's really going to help your mental health, you've got to balance that out and say, okay, you know, you really need this so that you can feel like yourself. I'm not going to tell anybody you can't do this, because I think that's quite...
just suggest,
has a negative effect.
Yeah, because then they'll be like, oh, now my physio has told me not to do that, not to do HIIT. And it's like, actually, I didn't say that. That's all you got from it. I never said that. I just said do less of it. We've done the same, just more suggest... I guess because we do exercise prescription, so we can say don't do it this amount of time, but we would just suggest more variety and just a different kind of workout week. And it's still super common now. Maybe it's less common. I think Pilates is definitely becoming more popular now, and like we've got like a shapes class that's Pilates inspired, and that's super popular. So I think people are kind of starting to understand the holistic approach.
Yeah, and not doing the same thing every day.
Oh, yeah, of not just thrashing their bodies every single day.
And it's that sort of misunderstanding too of exercise is good, so more exercise is better.
Yeah.
And it's not as simple as that. And also no magic pill. There's no one type of exercise that's going to solve all of your problems. You know?
Really?
I know, right? I know. I hate to break it to you all.
Even Carlos is shocked.
Niamh, do a lot of the women who come to see you, is it mostly after having a baby?
I definitely see a lot of younger women in their 20s with those conditions, or with endometriosis, and help them manage some of the issues they might have around that. Sometimes it is very musculoskeletal in nature, and they do just need to work with a good personal trainer, or really interesting. I think that because they've been diagnosed with something at a young age, they become very aware of what's good for the body, and I feel like they're really insightful, and so they already know what is good for the body. So I'll notice that a lot of people with endometriosis have already realised that they might do like yoga one day, and they've got like their breathing stuff, and then they'll do their gym stuff as well, but they've got a really good balance, because I think they've learned a lot about their bodies, because they get a lot of tension and hypertonicity in their stomach muscles, and so they often will get like cramping and pain in their tummy, and so that's one cohort. And then I see a lot of pregnant postnatal, and there's 2 physios who work alongside me as well, and then we would see everybody up to like the age of 80, but we do work alongside gynecologists as well. So we have a vast variety of people who would get referred to physiotherapy. So stress incontinence and prolapse, which is where you get your pelvic organ prolapse usually after birth. Sometimes you can be fine after you have your babies, and then things that might have happened after you had a baby don't become an issue until you become menopausal, and then that drop in estrogen causes like a scar to be painful.
How exciting.
I know. I'm just
I'm so excited.
Doesn't mean
I'm the one that's going to be
you.
45. You're 41. I've got all this to look forward to. But yeah, sometimes it can become a bit of an issue as you hit menopause, because our muscles get a little bit, you lose a little bit of your collagen, and your pelvic floor gets more stiff. You can, you get more joint pain as you're dropping your estrogen, and it's so important to do your strength training. We talked a little bit about this, but there's a lot of barriers to exercise for that 45 to 55-year-old woman, and if they only like doing HIIT, then I always encourage and say, go back and like do some strength training with somebody who knows what they're doing, and just go and work with somebody and get your technique, who knows how to coach you, but manage your pre-existing like sore knee and your sore ankle. Go and work with somebody who's experienced and try and almost getting people to prioritize themselves again. Because I think that we deprioritize ourselves and we get really busy in our careers at that stage of our life, and we might have teenagers or busy children, and a lot of time we're trying to juggle a lot of things. And I think I talk about investing in your health, but we need to invest in our health, and we do need to spend a little bit more time doing the variety of things like injury prevention, doing your exercise, doing something for, your anxiety might be a little bit worse because you're perimenopausal, and so you have to manage those kind of things. You're probably a little bit more advanced in your career, or you're back studying, or, those kind of things all we juggle quite a lot at that phase of our life. And so I always talk about exercise, because if you could package up all the things that exercise does, you girls might know how to do this. It is the magic pill, because it is.
Remember we did an episode on it?
The magic pill?
Yeah, that one day we'll come up with the magic
pill.
Yeah.
Well, that is the exercise.
It is. But imagine if there was a pill. That person would be a trillionaire, because people would be like, sweet, I don't have to exercise, I don't have to eat well, I'll just take this pill. And
what I find the difficulty thing is that it's like we forget how, I think that in the medical world, I think that we forget how it should be prescribed, like it should be prescribed, but you might not prescribe a certain exercise to a certain patient, but you might say, but you should go and do this kind of training because you need to do some strength training because you're going to have osteoporosis if you don't look after your bones, and you might, but we don't do that. So we actually have to find that ourselves. We have to know that there's a little gap in our whole society that we have to actually find that bit out ourselves. And I'm like, but it's free. When I say it's free, it's exercise. It's not a drug.
Yeah.
You can do it in any form, but you can learn from so many different aspects. So it's almost like there's so many other things have taken over. So everyone wants like the diagnosis, and you want the pills, and we want the quick fix of this is going to but sometimes your basic prescribing exercise should be an actual
everything. It should be an actual prescription. But then there's people like you in your profession who will talk to your patients about that, so you're kind of trying to fill that gap a bit. But then I guess not everyone is seeing
and I suppose people, you'll see your musculoskeletal physio when you have injuries and get you back exercising. And then pelvic health is a really big barrier to exercise. So, women who start leaking, or if you have prolapse, it can stop you feeling confident to go and exercise. So,
of course, because you don't want to be in a group fitness class and weigh yourself.
I know.
You know, like that
you would have
a massive barrier.
1 in 3 women will have got stress incontinence in general. So out of the 3 of us, one of us has got stress incontinence.
Who is it?
No, I'm gonna. So.
Oh, it looks like it's Nat.
I've worked on my pelvic floor, but back when you we haven't seen this, but Niamh used to do my classes. We figured out 9 years ago. But I used to ejacks, like jump jacks. I used to weigh myself a little doing that, and then I thought there's a problem here, and I would have spoken to Hannah about that, who my friend who's a physio as well. And so she gave me exercises at the time, all these years ago, of what to do. And now I don't pee myself when I do ejacks, would you believe? Yeah, but I did, and I haven't had children.
I always want to ask trainers, what is it about that exercise that makes anybody think that it's a good exercise for a woman to do? It's designed by men for men.
Jumping, exactly.
Well, you probably hit the nail on the head there.
A jumping jack is one thing, but I don't know if you'll think of the air jack, where you actually jump out and you shoot your arms and your legs out as you jump. Of course, that's going to be hard on your pelvic floor, right?
Yes.
Yeah, I don't know why. I didn't invent it, and I agree it was probably invented by a man that doesn't have issues about peeing himself.
I'm going to say the push-up was also invented by a man.
Why? Just because you're bitter about push-ups?
God, I hate push-ups. Anyway, yes, the air jack and,
There's other ways to warm up, isn't there?
Absolutely. Absolutely.
Yeah,
Don't have to do air jacks or jump jacks.
That's a specialised sort of movement for sure, and not particularly helpful if you don't want to wet yourself.
Yeah.
But thank you very much for being so honest about that, Nat.
Yeah.
That's what this podcast is about. Yeah, so you've come across people that haven't had children and they have that
stress incontinence.
Yeah.
We're starting to internationally want to have a new term. So there's stress incontinence, which is when you leak, if you cough, sneeze, jump on a
so
trampoline.
that was me when I jumped.
That was stress incontinence.
Yeah.
Urge incontinence is where you put the key in the door, and every time you put the key in the door, or every time you turn the tap on, you have this urgency in your bladder and you really need to go to the toilet. Or before you do one of your classes, people, you might see people like 2 or 3 times go to the toilet. They get
Just
like
before?
an urgency.
Nerves.
Yeah, it's a little bit like you can have a nervous kind of, it's like a neurogenic bladder, or you can have an overactive bladder where you feel like you need to go to the toilet all the time, but when you go and empty, you only empty like 50,
Just
100,
put a hand
like
up
a
and I'm
small
pointing
amount.
at her.
No, I do pee. I do
a lot.
actually pee a lot.
Because you probably drink a lot of water. Yeah.
I do.
Yeah.
I actually do.
So if your volume is equal to the bit that's coming out, then that's fine. But then there's another kind of incontinence called athletic incontinence, but it's not quite, because we're finding so many women leaking who, have never had babies, or elite athletes, or people who are really fit.
Hey, excuse me.
Fitness
I'm not an
instructors.
elite.
Yes, elite in your industry.
Athlete, no.
Elite fitness instructors. Is that what you would call yourself?
No, I wouldn't call myself that
She's
at all.
far too humble, but I will.
No one says that.
So the athletic one. So tell us a little bit more about that.
So I would say stress incontinence in general, or incontinence, is the most multifactorial, tricky, but can be really easy, but very tricky to solve, tricky to treat. Because when you're leaking and say you haven't had a baby or you haven't had a prolapse, we talk about that hypertonicity of your pelvic floor. So remember, your pelvic floor is like a hammock, and it should move and support the bladder. And the bladder comes down and the urethra is the bit where the wee comes out. Okay, that's a sphincter muscle, just like your anus is a sphincter muscle as well. If that pressure in your intra-abdominal pressure is higher than the pressure at the urethra, this is very basic, by the way, and
that's fine.
I'm challenging myself already just saying this. You will leak if one pressure is bigger than the other. When for some reason there's some reason other than just your pelvic floor sometimes that you can be leaking. So either you've just reached your threshold, and you could be a 15-year-old who's a trampolinist, and a lot of trampolinists leak because your body's actually just not made to train for hours and hours and hours jumping on a trampoline. So it's just our anatomy, and your ligaments and your ligaments and your all of your fascia, ligaments, muscles. There's just a certain amount of level that you have as a female that our bodies can take, right? We've just got more gaps than a male's perineum, it's just different.
Yeah.
The other thing is like your hips. Are your hips really, I always just look at people's backs and your hips. What's your hip mobility like? And that's why I say when you're doing too much of one thing, like, are they getting good range of movement in their hips? Have they got good function of their hip rotators? And if you're doing the same, just front squat, front lunge, not doing any rotation work, then you're just putting that load on the same part all the time.
Yeah.
And so that's why the variety is so important, because you want people to have good range of movement in their hips and their lower back, and they have good tone and good breathing patterning and good technique. And sometimes when you're just doing like HIIT, or nobody's checking you, or you don't have a good trainer or something, maybe you're just doing it not
badly.
Yes, can I say that? Yes. Yeah. So that would be if your tone of your pelvic floor is on all the time and you're not relaxing it, and then the pressure is higher in your abdomen.
So how would you treat it then? So because you said it's hard to treat, right, for someone that hasn't had a prolapse or a baby to leak.
Well, you would just look at everything. Look at how they move. Look at how they're training. I would see what they're like in the gym, or get videos of them. See how they do their squat and their deadlifts, and then work out, okay, is there something happening around their hips that we need to treat? And then see how that goes. Teach them how to breathe differently or mess around with that. And then there is like devices that you can use while you're doing this. It's not like we say stop doing your exercise. You can use like pessaries, or pessaries are like little silicone devices or incontinence devices that you can use to support them. A lot of CrossFitters would use them, I think, but because they tend to leak if they're doing such specific high intensity training. But historically, people think it's CrossFitters that are leaking, but we're finding out actually it's everybody. It's not just CrossFitters. It's just that there's been research done on CrossFitters.
Yeah.
So a lot of people are leaking.
I was one of them.
Yeah.
Wasn't I?
And good that you did your pelvic. Oh, you just.
Well, I just remember thinking this is not good. I haven't had kids yet. And this is not good. I'm already leaking. Yeah. So I did. Yeah, and I don't at all anymore. Yeah.
Right.
Would Nat then, when she's had a baby, be more likely to experience that again?
Yes, possibly.
Back to your exercises.
Yeah, more. Yeah. If you leak when you're pregnant, you're more. Yes, come see me. Like the good thing is that there's so much more that we can do that, like nowadays, and also. I just wonder whether we all. I'm not trying to I'm obviously always promoting people talking about these things, but I think the more you become aware of things in our society as well, then
you ever think it?
Then I think people are like, oh my God, I've got that thing. We want to diagnose ourselves, and you leaked once, in a year, you had one little dribble when you were laughing with your friends, it's okay. That you need to go and have surgery, it's fine. Yeah.
You don't need to go get surgery.
Yeah.
Okay.
Yeah.
So that's a good note to point out on here is if you've just leaked once in the last year, just because you had a really good laugh.
Yeah. It was worth it.
Yeah, and just know what your pelvic floor feels like. Can you squeeze your pelvic floor? Can you let it go?
Are you doing it now? Is she saying it? Yeah, same.
Yeah. What does it feel like? Or you can put your finger inside. You can have a look in the mirror.
Not doing that right now, I'll be honest.
Neither.
We might get
hands
censored.
above the table. Lucky we've changed our time slot to 11 a.m. on a Monday, not when the kids are going to school. I mean, it would be interesting for them.
So, know what your body is doing, and don't just ignore that part of your body because it's the pelvis and the genitals. We know we're so obsessed about our biceps and our glutes and your calves, and then you're like, oh, what about this bit through here? Okay, well, actually, how does that function?
Yeah.
And what's happening in that? And getting people to ask their clients actually those questions, do you leak when you exercise? Do you have painful sex? They're all just really important questions to ask. And sometimes people will say, oh, nobody's ever asked me that before.
Really? Yeah.
And your pelvis is a functional part of your body, so they're just the questions that we would ask to rule out what's happening in there.
How did you get into this? Why did you decide to specialise in this as a physio?
I think after doing lots of women's sports teams and lots of musculoskeletal injuries for many years, after the earthquake, I kind of wanted to do more education and work with pregnancy and postnatal, and then I got a job at the hospital as the women's health team leader, and then I learned how to do women's health internal exams through that process, and lots of courses. Back then there was hardly any courses, and you had to go to Australia quite a lot, but that's where I learned how to do internal exams and really assess that, because at university level we just ignore that part of our body. Nobody learns how to talk about those muscles at university.
Really?
Yeah, we don't do that. And even now, undergraduate, I don't think we do. It's more of a postgraduate area. Yeah. So that was fascinating to me. That's how I started doing education, and also pregnancy and postpartum, and talking about exercise and prevention. Yeah, so it's just kind of transgressed from there.
It's very cool. It seems like it's, you're really passionate about your work.
Yeah.
And just normalising these conversations, which is so cool.
Yeah, it's really important, isn't it, to try and reduce the shame about talking about these things, because so many people are so embarrassed about talking about it, but it's just another part of our bodies that we should be able to talk about. And I think it's very important to try and progress that, and the whole sexual education and wellness and well-being for women as well is so important to enhance that whole area so that women can be just more confident and to try and encourage them just to be living whatever their best lives is, because it is such a barrier to, and there's so much shame around that part of our body sometimes, that it's important that you can say, well, you know, this is what you can do. If you want to go back to the gym, we can use a pessary, or if you want to do this, you can work with somebody or work with a trainer for a little bit. Rather than just stopping, you know, like I think even young girls, you know, we stop exercising a lot. I think 13, 14, 15, there's a huge, when girls start getting their periods and start becoming more self-aware and self-conscious, they often drop out of team sports. And there's a whole push, I think, for that balance is better, you know, and encouraging females to participate in exercise, but it doesn't have to be what we traditionally said was exercising, but it can be in different forms.
Yeah, just because you're not going to be an elite sports person doesn't mean that you no longer get to participate in team sport, or just because you're not wanting to lose weight or change how you look doesn't mean that the gym is not an option for you. You know, like movement is so important for mental health, for well-being, for confidence. And, you know, so, yes, it's very concerning, that age group, young women who are dropping out of movement. And then, like we talked about it, then when do you gain confidence to come back to it?
Exactly.
It gets sort of harder, the barriers get bigger then.
And also, I don't know if you've been aware of, that in Ireland, the Irish women's rugby team have changed, you know, their shorts, because wearing white shorts was again a barrier to like girls.
Wasn't it the same? Was it another sport?
Football,
tennis?
I think.
Yeah, football,
was
I
it
think.
Football.
Ah, well, tennis makes sense. They wear white skirts. But
That's right.
exactly that. Like,
God,
who came up with that?
Stupid rule. Like, think of like the traumatizing moments where you've leaked through your clothes and you're wearing, like, you've had that with wearing white. It's like traumatizing. It's like, I'll just drop out of this sport then.
Well, luckily, I was in my 30s when it happened.
I know, but I mean, just for a woman.
Black and white tights, and I had the heaviest period in the entire world. And I was teaching a class. Started, I think, wearing shorts. Yep, felt it running down my leg. It's all right. I've done a podcast on it. I'll let you know which one.
You can listen to it. Yeah. But I mean, like, even say for a young girl to experience that while she's wearing the shorts, the white shorts, she's gonna want to pull out.
Yeah. Yeah,
you know
or you're
I mean?
not, or you're going, even half of the girls would already have just been like, oh, I'm not playing that. In case that happens, wouldn't that be so embarrassing?
Yeah, and
without probably even having it be a very conscious thought or a conversation, it would just be a very subconscious, I'm not going to risk that. I'm not going to risk it.
What I will say, though, what I've noticed, and this is, I've done zero research on this at all.
Get out.
So this is just my point of view. What I have noticed is more younger girls are coming into the gym to do strength.
Oh, great.
Yeah, and following apps.
Yeah. And
honestly, it's the coolest thing to notice. And they're doing, like, really good movements, you know, like they're doing the basics, like squats, lunges, deadlifts, hip thrust, things that I think they would have, when I was younger, you wouldn't do in the fear of becoming bulky.
Yeah.
You know, because weights apparently back then, they make you bulky, right? Yeah. But they don't. And now there's all these, you know, cool apps that are out that aren't just body weight for women. So I have, because I'm always
really
like,
good.
when there was like this big group, this is an example, downstairs in the functional space, like this is the functional space, right? And normally they would go into the women's gym, but this is like a main gym kind of part of the building. And there were like 6 of them, and they were doing like a good program, like it looked like it was good. And I kept trying to like look at where the phone was that they're following, and then I could see the app they were using, because I'm always trying to see like, how do you know what to do? You know, sometimes
how do you remember what to do?
Well, they're just kind of like literally following. Okay. But what's cool is that obviously sometimes the technique isn't great, but I think there's that's one good thing about the internet is there's a lot of good stuff that you can find out to
do.
know how to do, good technique. There's a lot of bad stuff on the internet as well, but this is one of the good things. Yeah.
I've got some questions for you.
Yeah, go for it.
So I don't know if you know a little bit about that research for menopausal women, because in our 40s we start losing bone density and our muscle mass is just literally just like with low estrogen. What is your thought about strength training? Because when I've done my research and done some talks about it, it's, at least I just try and say start from where you are, start resistance training now. Like that can be with a TheraBand, and then try and just like baby steps, and then try and get them either doing it at home if they're not gym people, or trying to encourage them to just start some sort of resistance training. But now there's that whole like intermittent fasting, I don't want to say that, or reducing your window of for insulin resistance, and not maybe not encouraging people to always eat before and say after exercise. And so in this phase of women, when you're trying to get them, they're menopausal, and they're trying to manage that insulin resistance, and often they're doing that window of like eating, like they don't eat till like morning tea, 12. But what if they train in the morning? What do you guys think? Should they be eating protein or something after they've done a weight session, or should they still not eat anything till their window?
My view on this is it's really dependent on the person.
Yeah.
Like if they... there's research, right? Like there's whole apps on this, like Dr. Stacey Sims, I'm sure you know. So she's really big on having protein within 30 minutes after exercising, and like if you download her app, it's quite cool. They'll tell you how many grams of carbs and protein and fats and stuff to have before and after, depending on what the exercise is. She obviously is an advocate of that. When I did research on this, and this is a few years ago, there was no real data that showed that you had to. Yeah. And I think it just really depends on the person. So like if they are really hungry afterwards, then eat. Yeah. If they're really exhausted, or they find that... like it just really depends on how they're feeling. Like just don't restrict yourself. Yeah. Just because you're in your, I don't know, intermittent fasting phase, and you've worked out in the morning, but you're starving, don't wait until lunchtime or whatever time you're going to eat. Just eat, you know.
That makes sense.
Yeah. So that's kind of my view on it. And when I talk to clients, I kind of just cater that to each individual. I kind of just ask them questions, like, are you, how do you feel at that time of the morning, or
that's really good.
What do you think?
What do you say?
I think it depends on the person. There's still a lot of research that needs to be done, I think, on intermittent fasting, but it depends on the person. And I think to be mindful also that it's not just another form of restriction. Because we've done that in lots of different ways over the years, lots of cardio and not eating very much, that, sort of. So I guess just to be mindful, it's not restriction and over-exercising packaged as something.
Exactly.
Something is,
Yeah.
So right.
But it depends, I think very much depends on the person. Like everything we've sort of talked about today, like for some people, they need to do pelvic floor exercises, and for others, that's going to be problematic, right? You have too much tone, and then there are issues with that. Unfortunately, it's one size doesn't fit all.
Yeah. And on the menopausal, definitely strength training is really, really important. So it's good that, tell them to do that. And strength training doesn't have to be with weights, like what you said with TheraBand. Like strength training is also just squats with your own body weight and, push-ups and things like that. So it doesn't have to be, especially if you're going from not doing anything at all, start with, either light weights or light body weight. Yeah.
And some of the osteoporosis research in the UK that's coming out with the exercise physiologist I just read said when they were doing these basic strength training with your bone responds amazing. Like you can still your bone responds to like change, so changing it up what you do.
Oh,
So
cool.
so they were saying, I mean, not changing every single day that you do, but so
Just
that's
phases,
why
going
working
through
with somebody.
phases.
Oh, sorry. Once working with somebody, but then not just doing right. This is my weight training. I'm 53 and I do the same thing. Actually, adding in rotation, changing the exercises that they do had a huge
That's
benefit
so
in the
interesting.
bone mass. Yeah.
Yeah. We are going to have to wrap it up. That's what Carlos said in our ears. But I would love, and I'm sure Jess does, to have you back on
Oh,
and do
thank
like
you.
a part 2 or something. And if you'd want to, we haven't discussed this off air. But I think there's so much more we can talk about.
Yeah.
And what would be cool is if you're listening and you have questions as well, we'll put an opportunity for you to ask questions.
As
that
long
we can
as
ask
Niamh is
you.
okay with us. That's why I was thinking that, and then I was like, maybe I should discuss this with her first.
That's
Yeah,
fine.
because I
Absolutely
feel
fine.
like you've, especially because you're so passionate about this, I feel like there's so much our listeners can learn from you.
Yeah.
Yeah.
Thank you. Thanks for your time.
Thank you
Thank
so
you
much
so
for
much.
coming on. So good to have you.
Well, follow us on Instagram at Babes Listen. Don't even know our name. That's good. And listen out for part 2 because hopefully Niamh will come back if she had a good experience. Bye.